In a real sense, we're all caught in an inescapable network of mutuality, tied in a single garment of destiny. John Donne placed it years ago in graphic terms: no man is an island entire itself. Every man is a piece of the continent, a part of the main. And he goes on toward the end to say, any man's death diminishes me because I'm involved in mankind. Therefore never sin to know for whom the bell tolls. It tolls for thee.
That was Dr. Martin Luther King Jr. speaking at Stanford University in April of 1967. Hello, my name is Rhea Farberman. I'm the Director of Strategic Communications and Policy Research at Trust for America's Health. You may know us as TFAH. Thank you for joining us. This month, we observe two important days in the mission to advance racial equity: Dr. Martin Luther King Jr. Day and the National Day of Racial Healing. These events give us the opportunity to talk to TFAH's president and CEO, Dr. Nadine Gracia, about the significance of these 2 days and about public health's role in advancing health equity. Dr. Gracia, welcome.
Thank you, Rhea. It's really a pleasure to have this conversation with you.
Indeed. Dr. Gracia, let's begin by talking about these 2 days and what they mean for you. What is their significance, both personally and professionally?
Well, yes, Martin Luther King Jr. Day and the National Day of Racial Healing really are two important days for me, for our organization at Trust for America's Health. You know, Dr. King certainly was such an incredible leader in terms of leading the movement for civil rights and equality. He was also really a steadfast advocate for the nation's working class, for not only in this country, but also people who are oppressed all over the world. He spoke about the need for economic opportunity, for fair housing. He even spoke about the inequality and injustice in health and health care. And that resonates, and that's so important because we know that health really begins before you need medical care. Health begins in our homes, in our neighborhoods and communities, in our schools and in jobs. And that our mission at TFAH is to ensure that every person and every community has the opportunity for optimal health. And so we work to advance these policies and solutions that are going to assure the conditions that actually create opportunity for every person and community to reach their fullest potential for health. So when we think about Martin Luther King Jr. Day and the National Day of Racial Healing, they really serve as an important way for us to continue our focus, to be intentional in our efforts to promote and advance health equity. They remind us that we need to redouble what we are doing to assure that there are still disparities that exist in our nation. And while there's been important progress that's been made over decades, there's still so much more work to be done.
Indeed. Dr. Gracia, help our listeners understand the concept of structural racism. What is it, and how does it impact health?
Structural racism, it refers to the structures in terms of laws or policies, institutional practices, entrenched norms in our societies that assign value based on race. And what that leads to is it unfairly disadvantages some individuals and communities, and it unfairly advantages other individuals and communities. And as an end result, it then leads to depriving our nation of the ability to reach its full potential in terms of health and well-being and opportunity and prosperity. And it has far-reaching effects. It cuts across systems and has an enduring effect across systems, whether that's in health and health care, in education, in economic opportunity, in housing and transportation, in our environment. And so in order to address it, we have to really look at those far-reaching effects of structural racism and how this is not only the historic policies and laws, but also leading to the present and ongoing impacts of those historic policies and laws and to our present policies and laws and how those disproportionately impact people of color and create disadvantage for attaining optimal health.
Dr. Gracia, you mentioned access to health care a few times. Talk about the importance of access both to health systems in general, and by that I mean healthcare systems and public health, and how we can build trust in those systems. I would say, and tell me if I'm wrong, but I would say that access is one issue. Trust in those systems is another. What can public health do to increase trust in health systems for all health consumers, including for people of color?
Well, yes, that's right, that having access, equitable access to systems, health and health care is important for all people. And also assuring that those systems are trustworthy, that individuals and communities feel comfortable, feel heard to be able to access those services and systems. That is important so that everyone benefits. And therefore, we can truly attain optimal health for every person and community. When we think about this in terms of public health, I think let's talk about public health and its role in communities. Public health promotes and it protects the health of people in communities. And that is from protecting communities against disasters and disease outbreaks. That's implementing and providing services and programs that promote maternal and child health. That's helping to promote vaccination to prevent infectious disease outbreaks, to also assuring that we have access to clean water, that our air is clean, that our food is safe. So there are a whole host of responsibilities and functions that public health has that it performs on a day-to-day basis, not only in times of emergency, but on a day-to-day basis to promote health and well-being for the residents in their communities. And so when we think about this importance of trust, it is critically important for the public health system to be equitable, to be resilient, and to be trusted, and trusted by the people that it serves. And so some of the strategies and ways in which public health really works to build and earn that trust is, for example, through partnerships, partnering importantly with community partners in a way that's meaningful, that it's authentic, whether that's in understanding and planning for the types of programs and policies that are needed in communities, hearing the voice of those who have the lived experience to identify what the assets are in a community, but also what the needs are in a community. And then assuring that you're sharing information so that they are really trusted partners, but also trusted messengers, especially when we think about community-based organizations, the faith community, working with other civil rights groups and groups that focus on equity, who can be trusted messengers to be partners with public health. That's critically important. It's also important that the workforce of public health also represents and reflects the community that it serves, to be able to bring forward that lived experience, but also to earn the trust of the community that it is serving, to be able to put community perspective into place when we think about the types of policies and programs that public health works to advance.
I know another point of emphasis for TFAH is the social determinants of health. We haven't talked about that yet. Describe those for our audience and why are they important?
Yes, when we speak about the social determinants of health, what we're saying and what it means is that, our health is influenced by where we're born, where we live, where we grow, where we go to school, where we work, and where we play, where we age. These are all factors and conditions that actually have a strong influence on health. Having access to healthcare and the quality of healthcare is very important. What we also know, though, is that these social and economic conditions play such a critical role with regards to health. And it's as I mentioned that, health really starts in our neighborhoods and homes and communities and our jobs and our schools. So when we think about how to promote health and well-being, it's important that we also consider, do we have resources and the conditions that actually promote health in our neighborhoods? That's, for example, having access to good jobs that pay a living wage, having access to safe and affordable housing, access to affordable and nutritious, healthy food, living in neighborhoods and communities that have bike paths and walking paths, playgrounds and parks, so that you can engage in physical activity and feel safe in your community. It's assuring high quality education and access to economic opportunity, as well as access to high quality healthcare. And what we know, and especially in thinking about this in terms of Martin Luther King Jr. Day and the National Day of Racial Healing, is that for far too many people of color and communities of color, there has been over many, many decades, a disadvantage in terms of access to those health promoting resources and conditions in their communities. Whether that's when we look at historically, for example, residential segregation and the history of discriminatory housing and lending policies that led to some communities being segregated in their communities, but also not having access to high quality schools, access to health care, access to good jobs with a livable wage. And then that has an enduring effect across generations because you have concentrated poverty, for example. You have lack of the ability for mobility to be able to access other opportunities. And what studies show is that all of those factors are linked to poorer health outcomes. And so when we look at racial and ethnic health disparities, I have to put it into context to understand that that's rooted in that type of historical to present day inequitable policies and programs and access to resources that actually promote health and well-being.
Yeah, and as you say, we see these patterns in the data. There's a there's a link between historical racism, structural racism, and health outcomes today.
That's right. And if I can add to that, Rhea, when we talk about the importance of addressing the social determinants of health, we also look at structural racism in terms of what it does, biologically and clinically, where studies are also showing that it leads to these higher stressors. All right. When you experience and are exposed to racism, it's not only you have the economic stressors from it, as we've talked about, but also the mental and social stressors that you experience. And then also see this translate into having higher rates of the types of stress hormones that lead to higher inflammation. And that inflammation then leads to higher risk of disease, either earlier onset of diseases, earlier deaths, or increased severity of diseases. And we see that, for example, with chronic diseases and higher rates of diabetes or heart disease. And while all of that is disturbing, we can see that that's just as disturbing when we look at areas and we account for education level, we account for income level, but you still see the disparities by race and ethnicity. Clear examples, for example, of maternal mortality and infant mortality, and studies that have shown, for example, that people of color receive a lower quality of healthcare when they do receive healthcare. Black patients, for example, who are undertreated for pain, or people of color who are less likely to receive referral to services, specialty services and other treatments. This is why has such an enduring effect and why we have to really have an intentional focus with regards to the types of strategies and approaches that we take to really dismantle structural racism in our society.
So let's talk about how we go about as a society dismantling structural racism. What are the keys to being able to do so?
Well, first and importantly, it's important to acknowledge that it exists, that it is a root cause of and a driver of why we see these disparities, these differences in health outcomes, but also other factors, whether it's in economic opportunity or housing and other spaces, why we see the disparities that we do in our society. And so making that acknowledgement that structural racism exists, and then being very intentional about examining the types of policies and laws and institutional practices that may be perpetuating the impacts of a structural racism that inadvertently are actually contributing to or exacerbating these poor health outcomes that far too many people of color and communities are experiencing. And, as we do that, then it leads to examining the data and saying, do we need to change those laws and policies? Or is it that we need completely new policies and laws and institutional practices? And then not only just changing and or creating new, we need to then be able to assure that those policies are then enforced and that there's accountability and that we're measuring and determining, are we making progress? Are we closing gaps? Are we seeing that there is fairness that is happening in terms of opportunity and that there's improvement in outcomes? And in doing so, you then can be able to monitor progress over time. But what's also needed is that we have to invest. Far too many communities of color have experienced a disinvestment in community. And that disinvestment leads to the limited resources in terms of, having grocery stores that sell fresh fruits and vegetables, having jobs in the community that provide living wage with good benefits like paid sick leave, having high quality schools that give our children an opportunity to thrive. And, we know that having high educational attainment, having economic opportunity, they're such important predictors of health in the long term. And so it's important that we also then invest and assure that the resources are available for people in communities to be able to thrive. And then we have to also make sure that as this is being done, that the assets and strengths of community are really uplifted. And that's where ensuring community voice, the empowerment of community in terms of leaders and members and people with lived experience, that when we talk about investing and directing resources, that we're focusing on who's most disproportionately impacted. And then are they benefiting? Because as you implement those policies on the people in the communities that are most impacted, it actually then also helps society as a whole. The challenge for us has been there's been a marginalization and an exclusion of many people of color and many communities of color such that we are not essentially reaching our full potential because they don't have access to those resources and opportunities.
Can you share an example or two of a policy recommendation that TFAH is working to advance that will help the lift up that you're talking about?
Absolutely. It's creating these ladders of opportunity. One is, for example, the earned income tax credit, which helps families that have low incomes be able to provide some supplementary income, which we can see helps to lift families out of poverty. And it has both health and economic impacts. In terms of the economic impacts, it increases income. It also increases access to services that might not otherwise be attainable. We see as well in terms of health that there are improved outcomes, improved nutritional outcomes, for example, for children, improved maternal outcomes for mothers. And there's a benefit there that then can have not only the impact for parents, but for their families as a whole. And so that's a policy both at the federal and at the state level that can be implemented to support what we were describing earlier about those conditions, economic opportunity, access to nutrition that can help families. Because when you're struggling to make ends meet, then you have to make hard decisions about, am I getting the fruits and vegetables and other foods that are healthy and nutritious but are more expensive? Or do I get these other foods that are less expensive but they're high in calories and are not nutritious, and therefore then put us at greater risk, for example, for diet-related diseases like obesity and diabetes and other conditions. So advancing policies such as these really help us in addressing not only economic impacts, but also health as well.
Well, thank you, Dr. Gracia, for what's been an engaging and educative and important conversation. So thank you for that. Any closing thoughts?
Yes. I would say that one, understanding the disparities, these racial and ethnic health disparities, is really understanding that this is more than individual choice. And it's not a random occurrence that is happening, but that this is really rooted in our history to our present day of having structures and systems that do not provide opportunity to all people in communities to be able to promote optimal health. And that we have to be intentional. We have to sustain our efforts really to examine those policies and structures to be able to promote health and well-being, but also that we don't need to and can't do this alone. This is not for any one sector to address. It's not only public health or health care to address racial and ethnic health disparities and the inequities that we see across systems, but that everyone has a role to play. Certainly government at all levels, federal, state, local, territorial, tribal governments, their engagement in addressing this. But also when we look at the private sector, whether that's looking at the employers and businesses, partnering with community organizations and faith-based organizations, and looking at other sectors like education and housing and transportation and our food systems, every sector has a role to play. And we have seen where there is progress. When we are focused and intentional, when we collect and gather the data, when we have the voice of community and we measure that, we can see progress. We have to sustain that. And for far too long, we've either disinvested or we haven't sustained the efforts and expect to see change in such a short period of time. So we have to act with a sense of urgency because the health and well-being and the prosperity of our nation truly depends on it. That's the call that certainly I would believe that Dr. King would challenge us to continue to strive for that and to not yield and relent until we do. That's his legacy to us, to assure that everyone has the opportunity to reach their full potential for health.
Thank you, Dr. Gracia, for this opportunity to engage in Dr. King's legacy. It's an honor. And thanks to our listeners. Check the TIFA website at tfah.org for more information about our work to ensure that every person in every community has the opportunity for optimal health.